everyone, Professor Davis here, and we are going to look at the urinary system from the lens of medical terminology here. So real quick, before we get into the terms and things like that, let's look at the functions of the urinary system. So when we're looking at the urinary system, it is going to filter our blood, and the main purpose is to filter out the liquid waste. This liquid waste is things like urea, but all of those waste products that your cells create through cellular respiration. So these are those byproducts of breaking down, whether it's carbohydrates, proteins, fats, whatever it might be. Another thing that your urinary system does as well is it maintains your proper balance of water. So making sure you have enough water so your kidneys can hold on to water if they need to or get rid of extra water. Same thing with salts. Any of your electrolytes fall into this, where the kidneys can work on holding on to some or letting others go, and any other substance that you may have too much of that the kidneys can help get rid of or hold on to. Another thing is that your kidneys or your urinary system is going to maintain your blood pH. It does this by the concentration of hydrogen ions, whether you release a lot in your urine so your urine becomes acidic, or you hold on to them. And then, of course, once the urine is created by the actual filtering of the blood by the kidneys, we need to then transport that urine and eliminate it out of the body. So eliminating the waste as urine then travels through the ureters, into the bladder, and then out the urethra. So a quick note on this is pay attention to the placement of the kidneys. The kidneys are actually a lot higher than you might think. They're right underneath your rib cage towards the back, and they are not part of the covering of the peritoneum. So we talked about in previous classes that there's these coverings that cover the heart or cover the lungs that are going to give some extra protection for friction. Those are called the serosa, or the pleural membrane, pericardial membrane. Remember, the peritoneum is the one that kind of covers a lot of your abdominal organs. Your kidneys are not covered by this. So they are considered retroperitoneal because they are behind the peritoneum. The bladder is also located in the pelvic area, and so it is going to be found behind your pelvic bones. So let's look and trace the path of urine as we go through this kind of picture. So we see that it starts at the kidney. This is going to be where the blood vessels come in. You can see that here with the renal artery going in, the renal vein coming out. The blood comes in, and the kidney is actually going to do the filtering. This filtering then creates urine, and it's going to leave through this kind of yellowish tube leaving the kidney, which is the ureter. The ureters then can go and connect to the bladder, which is a storage area for your urine. It then is going to release it through the urethra out of your body. And so that is how we trace urine from the kidney out of the body. So let's look at some of the urinary system word parts that are going to be important when we're looking at this. So uro, or urine, and urea all deal with urine itself. Okay, so there's different ways you can see here. So when you have urology, it's going to be the study of the urinary tract. Okay, when you look at urine analysis, it's going to be where you are breaking down and analyzing what's in the urine. Okay, if we are talking about dysuria, it's going to be difficulty or pain urinating. Okay, and so those are going to be some of those root words we see there for urine. Genitals is going to be organs of reproduction, so we call those the genitals. Okay, so that's going to be whether it's a male or female. Gona is going to be the genitals of reproduction as well, but when we look here, that's going to be what we would call the gonads. And the gonads are the ones who actually are producing the egg and the sperm, which are the gametes. Recto is the rectum. Cysto is what we call the bladder. So when you see cysto, but cysto can also mean cyst or fluid-filled sac. So you have to kind of be careful with that. But think about, a bladder is a fluid-filled sac. It's just full of urine instead of other things. Nephro is going to be the part with the kidney, and reno also goes with kidney. So you kind of have two terms that go along with kidney. Ureto, which is the ureter. So this is going to be the connection from the kidney to the bladder. And then the urethra is going to be from the bladder to the outside world, the urethra. Vesico is also going to be a term that can be used for the bladder, or what we call a blister. Glomerulo is going to refer to the glomerulus, and this is an area inside the kidney where the filtering of the blood to create urine is going to occur. And then pileo is going to be the renal pelvis. And so because the kidney is like bean shaped, this kind of middle area of that bean where the blood vessels are going in and coming out, that's called the renal pelvis area, where you're going to see the urine is going to collect in the kidney and collect there and go into the ureters. I'll show you a closer picture of that here in a second. So if we look here, this is a cross section of a kidney so that you can see what it looks like. The outer covering of the kidney is called the capsule, kind of like how you have a capsule around medication. We then go inside and you have two main areas. You have the medulla and the cortex. The cortex is the outer part, so you have the capsule and then the cortex. Then we have the medulla. The medulla is going to be where these pyramids are located. So the pyramids are the medulla. In between each pyramid is what we call a column, and that's going to be the cortex. The part right here in the middle is going to be the part that is known as the renal pelvis. In this pelvis region, you see the blood vessels coming in with the artery. You see the renal vein is leaving, and then also in this area you see the ureters. That indent of the kidney is called the hilum. Okay, and so this is a really important structure to look at because we have lots of stuff coming in and out of that hilum area of the kidney. Now what's happening in these renal pyramids, guys, that's where the blood vessels go in and the actual filtering takes place. This is where it's going to filter the blood and actually create or form the urine. Now, what structures are going to form this urine? These are going to be the nephrons, and there are thousands of nephrons located inside of those pyramids. And so the first picture over here is looking at the nephron without the blood vessels, and the second one has the blood vessels wrapped around. Because, guys, when we create this urine, there's a constant back and forth that is happening as this blood is getting filtered. So some stuff goes to the urine, but it may go back to the blood. Some stuff then goes back to the blood and needs to go back to the urine. So there's a lot of back and forth until we finally get the blood clean on the end of these nephrons. You can see that the afferent arteriole comes in and it's going to bring the blood towards the glomerulus. This is also going to be located in an area called the Bowman capsule. In this area, there are these little filtered areas or slits, and it's going to filter out the fluid. The fluid then enters the proximal convoluted tubule. At this point, we start to see that this filtrate that's been created, it's not urine yet, but there's a back and forth with the blood vessels. Okay, where it's like, oh, you gave me too much water, take this water back. Oh, you gave me too much of the protein, take this protein back. It's a constant back and forth. We then see that this filtrate is going to go into the descending limb, as well as then all the way down and back up the ascending limb. This is known as the loop of Henle, and this is going to allow again for an exchange. Now the descending limb, you'll notice and you'll see, has got a lot thinner structure to it because it's going to allow water to pass. But when you get to the ascending limb, it's thicker and water cannot pass through there. All right, and so this back and forth is going to be different on the descending limb versus the ascending. The last chance to clean out anything of the blood or to put anything back from the filtrate is going to take place in the distal convoluted tubule. This is going to be where we get that last chance of seeing what needs to go back to the blood and what needs to come back out of the blood. So it's your last chance to clean, and then the urine goes into the collecting duct. The collecting duct then sends the urine to the actual pelvic region of the kidney, and it drains through the ureters to the bladder. Okay, so this is looking at the nephron, which is the functional component of the kidney. So if we're looking at the kidney, you do see that we have the nephron here where you have the glomerular filtration. That's the beginning of the creation of urine. We call it the filtrate. You then have the tubular reabsorption where we have this reabsorbing it back to the blood, taking some things back, and then tubular secretion where we put it back from the blood to the urine. So there's a back and forth. Again, this is going to continue to happen until the urine enters into the renal pelvis, goes into the ureter, draining to the bladder, and then finally out of the body through the urethra. So again, we have some urine word parts here. We have the urine, which means, of course, urine. You have nocti or nocto, which is going to be for night. You have oligio, which is going to be scanty or not very much. You have also some things that can be abnormal in the urine that you shouldn't have, like albumin, which is a protein. There should not be protein in your urine. Glyco or glycose, which is sugar. If you have that in your urine, there could be something going on like diabetes. Hemato is blood. Blood indicates that something is wrong, like a kidney stone or an infection. You also have keto or ketone, which is going to be looking at ketone bodies. This is something a lot of times when you're on a keto diet or certain diets and want to go into ketosis, your urine can let you know if that's happening. But you have to be careful because it should not be in huge amounts. Proteo or protein is again a protein that could be in the urine, and pio is pus. So again, these are things that should not be located in the urine. A lot of this is going to be detected by doing what we call a urine analysis. So taking a look at the actual urine and what's composed in there. So if we look here, guys, you can use some of these if we're talking about with night. Nocturia is whenever you have to get up and go and urinate during the night. You also can have oliguria, which is where you don't produce very much urine. It's very little urine that's being produced. All right, some laboratory tests that go along with urine. Of course, we're going to see looking at the idea of how much urine is coming out versus what kind of fluid you're taking in. So this is an intake and output type of test. So they would give you a certain amount of fluid. They would then see if your kidneys are able to get that fluid off of your body, because your intake and output should be similar. Creatine clearance test is going to be where they're seeing how well creatine clears your kidneys and how long it takes. You can also see a renal clearance test, and that's to look at your efficiency of your kidney, like the percentage of how well it's functioning. And then we can also do a blood urea specimen, where we would take a culture of the urea and we would look to see if anything grows. This would be used a lot of times to detect if you have a UTI and what kind of bacteria is causing the UTI. Again, urine analysis is where we would take a look at the urine. We would look at the physical side of the urine first, like the color, the turbidity, how cloudy it is, or if it's clear, the specific gravity, how much is dissolved in it. We could look at the chemical composition as well, with the pH levels, amount of sugar in there, ketones, protein, and even blood. A lot of times we use little like dipsticks that you see like when you're testing the blood, the pH of your pool or something. You would use something like that. We can also do a microscopic analysis where we look for epithelial cells, blood cells, bacteria, or even crystals to see if maybe like a kidney stone is present. Now, we do see that sometimes we are not able to get the urine out like we should, or maybe we need to have some help, like if you're having a surgery. This would be urinary catheterization. This is going to be where they put a catheter in. Indwelling catheters are meant to be left in place for a prolonged period of time. So these are not going to be ones that you just get put in for a surgery and then once you are able to get up and walk to the bathroom by yourself that they take these out. These would be those that are going to stay for a extended period of time. A Foley catheter is held securely in place by a balloon. So they place the tube through the urethra, and then once they get it in, a balloon blows up and holds it in place so that the tube cannot easily be pulled out. We also see a lot of times it's filled with a sterile liquid after you put the catheter in to make sure that it's in the correct place and being able to then drain that fluid back off. Now, there's different ways of placement for catheters used to divert the urine to different areas. You see that there could be what we would consider a urethral. Urethral catheters are usually going to be passed into the distal ends of the ureter from the bladder via a cystoscope. So this one's going to be a little bit more where we're going to go through the actual walls. We see that we can also use a suprapubic type of placement. This is going to be where we would surgically place the actual catheter tube through the skin above the pubic bone so it doesn't actually go through the urethra. And then we have the nephrostomy, and this one's where the catheter goes straight into the renal pelvis, bypassing the ureters and the bladder altogether. So these are just some different placements. We also see that we can do a urodynamic study. These are going to be where they measure aspects of voiding, like how often you go to the bathroom, how well you're able to empty your bladder. And this is to evaluate if you have urine flow problems. And so we do see that there's the cystometrography. This provides information about the effectiveness of the bladder wall muscles. It may incorporate the use of a urinary catheter. They may use a cystometer attached to measure the bladder's capacity, like how much urine it can take in. We also see they could use an electromyography. When we're using electromyographies, these are going to evaluate the strength of the muscles that are going to help empty the bladder. So pushing the actual urine out in order to help make sure that it empties completely. All right, so there's some radiography or radiology that's going to come into play when we're talking about the urinary system. So we have the nephrosonography. When we're talking about that, we're going to use a sonogram type structure or machine in order to look at the nephron specifically. Nephrotomography, and this particular one is going to be where you are looking at the actual image of the kidney using what we call tomography. We also have the intravenous urography. This is where we use x-ray imaging of the entire urinary system, so the whole thing that we are looking at. We then have the voiding cystourethrogram. So they are going to take a series of pictures before, during, and after voiding or urination takes place. So they're seeing what's happening to the structures, specifically of the bladder, as they're going through that process of releasing the urine. And then we have the renal angiography. And this one is to actually look more at the blood vessels that are servicing the kidney. We also have some urinary endoscopies where we're going to use those cameras. So a cystoscopy is going to be where we would go up and look into the bladder. And a cystourethroskopy is going through the bladder, but also the urethra. The nephroscopy is where we're going to go all the way up into the kidney and look at the nephron. Uteroscopies is going to go look at the ureters, and the urethroskopy is going into the urethra. And so it's important that we're looking at the different components. And so depending on how high we go, depends on which one we're looking at. We then have some pathologies. This is where we're looking at the urinary disorders. Nocturia we talked about, which is dealing with having to go to the bathroom at night. Oliguria is going to be where you're not producing very much urine. You have polyuria, which is you're producing way too much. Urgency and frequency go along with this. So the urgency is like how often you feel like you need to go. Frequency is how often you actually go. So you might have a feeling you need to go, but you don't actually go to the bathroom every time. One thing to note too is that the urinary system is a reflex. So once you release that sphincter of the urethra, leaving the outside, that skeletal muscle, it's going to just release the urine. This is why we have to do potty training, because it is a reflex. It's going to just happen. We have to train it not to just happen. We have to train other muscles in order to help control this so that you can hold it. Okay. We also do see that there's some kidney disorders here. So we have uremia, which is going to be blood in the urine. Renal failure can be acute or chronic, and this is where the kidneys are failing to do their job. And so you have waste products building up within the body. Nephromegaly is going to be where the nephrons are going to be enlarged. And again, when they're enlarged like that, they're not necessarily doing their job. You have nephrolysis. So nephrolysis is destroying of the kidney. We then have nephromalacia, which is an abnormal softening of the kidney tissues. You can also have polycystic kidney disease, and this is where lots of cysts are forming within the kidney. So nephrotic syndrome is going to be where you have an abnormal condition of the kidney, but it's characterized by marked proteinuria and edema that's taking place. It a lot of times is due to a complication of systemic diseases like diabetes that can occur. We also see renovascular disease. Now, when we're talking about renovascular disease, this means it's talking about the vascular tissue, so the vessels, the blood vessels, the arteries and the veins that are servicing the actual kidneys. So you have renal artery stenosis, is where the artery coming in that's bringing blood to be cleaned is going to have stenosis. It's going to be a narrowing that takes place. This can create renal hypertension, where there's high blood pressure happening within the kidneys. And so this can also lead to excessive amounts of certain kinds of hormones that are present. We have nephrosclerosis. This is a hardening of the small arteries that are found in the kidneys that go to the actual nephrons. And then you can also have a renal vein thrombosis, where it's an actual blood clot that's found in that renal vein. And that can become an embolus if it gets knocked loose. We also have obstructive nephropathies. This is going to be where there's something blocking the flow of the urine and how the nephron works. So you have hydronephrosis. This is where the renal pelvis becomes distended due to excess fluid developing in there because it can't leave. You can also have hydroureters, where the ureters do the same thing with that expanding. We can also have urolithiasis, which is going to be where we've got some actual stones that are forming. Nephrolithiasis means that it's going to actually be in the nephrons themselves. The lithosis is going to be where it is in the ureters, and then cysto is it's actually where these stones are in the bladder. So it just depends on where they are located. All right, and so these a lot of times are known as cannuliculi or kidney stones, and they start normally in the nephron and work their way down as they leave the body. And those are very painful things. Kidney stones are really terrible to have. Some surgical and therapeutic interventions that are present when we talk about the urinary system is dialysis. So if the kidneys are no longer functioning like they should, we need a machine that's going to help them do so, help them clean out the blood like they should. And so this is a machine that we can do. Now there's a couple of different ways. We have the hemodialysis where they take the blood out, run it through the machine and put it back in. You also have the peritoneal dialysis. This one's going to be where they go through the peritoneum, that structure, and they're going to use it to help filter through. And this one is going to be one that's normally attached to the person, and the individual can end up walking around a little bit more, be more free, and they're not attached to the machine like we see with the hemodialysis. We also see a lithotripsy. This is going to be where they would break up a potential kidney stone, and so they can go in and they can break that up. They'll also work on washing it out. And one example of this is the ESWL method. This is an abbreviation for extracorporeal shock wave lithotripsy. So they're using sound waves or shock waves to take care of that. We can also have a renal transplant where we do a kidney transplant. One thing to note about that, if you'll pay attention in your textbook, it shows where they add the kidney in. They don't actually normally take the old kidney out, but they attach the new one, and it's more in the pelvic region, not as high as it normally is. You also have the uterocystostomy. Now, a cystostomy is going to be where we are actually doing a surgical procedure with the bladder itself. This is where the bladder might need to be removed and taken out. This one would be going through the urethra. You can also do a suprapubic cystostomy where they're going to take it out through that area above the pelvis. They can also do a laparoscopic nephrectomy. In this case, they're going to laparoscopically go in, and a lot of times this is to help remove kidneys from the nephron area. We can also see that there's a percutaneous transluminal renal angioplasty. And this is where they take another area with a kind of a graft of a vessel, and they're going to place it in place and replace the ones that go to the kidney. A pyeloplasty is going to be a surgical repair of the renal pelvis. And then we have a nephropexy. So nephropexy is going to be where there's a surgical fix of a kidney that's kind of floating and it's not held in place like it should be anymore. We have some pharmaceuticals that are also, so these are going to be things used a lot of times with treatment with urinary tract infections like antibiotics. You can also see analgesics, which are painkillers, and increased intake of water. But then you have antidiuretics, which are going to suppress urine formation in some cases. Antihypertensive, reduce blood pressure in the kidneys. Anti-infectives are going to fight microbial infections like with UTIs that might not be related to bacterial issues. Antispasmodics are going to relax the smooth muscle of the bladder, and this can help with overactive bladder, where bladders are overactive and wanting to release urine too much and too often. Diuretics, which are going to increase urine formation. And then you also have urinary pH modifiers. These are going to alkalize or acidify the urine, and this is a lot of times to help prevent kidney stones. So if somebody is actually producing kidney stones on the regular, they may take something like this to help with that. And we also see it can be used to treat things like acidosis or metabolic alkalosis, or to help you excrete certain drugs or toxins if you have had a buildup of something in particular, like some sort of drug or toxin. Get it out of your system. Last but not least on here, we have the abbreviations. So you have a lot of different abbreviations in the back of your book, but we do have some listed here. So you have ARF, which is acute renal failure, BPH, which is benign prostatic hypertrophy. So this is where the prostatic gland is going to enlarge, and this is common in men as they age. We also have BUN, B-U-N, which is blood urea nitrogen, and this is going to be a type of test on a blood test. CRF is chronic renal failure. IVP is intravenous paleogram. KUB is kidneys, ureters, and bladder. So when they say KUB, they are looking, maybe it was a picture of the kidneys, ureters, and bladder. Another thing is some other medical terms that are used with abbreviations that are found a lot in the urinary system is pH. This is the potential of hydrogen, so the amount of hydrogen that's present. This is our pH scale. We have PKD, which is polycystic kidney disease. TUR, which is going to be transurethral resection. TRUP, which is transurethral resection of the prostate. So actually taking the prostate out through this process. You can have what we call UA, or they do like a U/A. That's not on here, but that's for urine analysis. We also can see a UTI, which is a urinary tract infection, and VCUG, which is voiding cystourethrogram, where they are going to look at how well the bladder releases urine before, during, and after, okay? And so making sure that is working properly. Now, of course, there are way more abbreviations located in your textbook, but again, this is just a review to kind of get you started, get you into the chapter of the urinary system, and if you have any questions, please let me know.